We have removed the lung and followed branches of the pulmonary vessels and the bronchi into the parenchyma of the lung. And then we've placed the lung back into position to highlight our relationships in the hilus. We now indicate the superior portion of the field and the inferior portion. We show the ascending aorta medially and parenchyma of the lung laterally. At the hilus, we identify the arch of the azygos vein arching over the right mainstem bronchus to enter the superior vena cava. We identify the proximal end of the right mainstem bronchus and the distal end. We indicate the proximal portion of the right pulmonary artery, and we indicate the two cuts here in the distally. We now indicate the proximal portion of the superior pulmonary vein and the distal portion. We've now retracted the lung slightly laterally to get a better view of the branching pattern of the vessels and bronchi. For orientation, we now show you the apex of the lung, where we can see we've cut into the parenchyma. We show inferiorly the middle lobe of the lung. Medially, we indicate the right mainstem bronchus, and laterally we can show the cut edge of the parenchyma of the upper lobe. We now reorient ourselves here to the hilus. We show the right mainstem bronchus, and we show the two cut ends of the right pulmonary artery and the pulmonary vein. Anteriorly, we can see the anterior segmental bronchus here, accompanied by a segmental artery. And just inferior, we can identify a pulmonary vein draining into the superior pulmonary vein. In the middle lobe, again, we can identify a segmental bronchus and an accompanying artery, and medially, a branch of the pulmonary vein draining into the superior pulmonary vein. In this dissection, we've removed the pulmonary vessels in order to get a better view of the branching pattern of the bronchial tree. We've incised the walls of the bronchus in order to get to look at the interior. For orientation, we show the cut end of the right mainstem bronchus and the cut end of the right pulmonary artery. We can identify now the superior lobar bronchus, and we can see it branching into a superior segmental bronchus and an anterior segmental bronchus. Inferiorly, we can identify the middle lobar bronchus here and the lower lobar bronchus, and we can identify here also the superior segmental bronchus, which is clinically important, and it is at this branch point between the middle lobar bronchus and the lower lobar bronchus where aspirated foreign objects often become lodged.